Good day, everybody, and welcome to the third week of Entrepreneur in Pharmacy. We're going to be covering two lectures today, and these two lectures are going to be covering the following topics. We're going to be talking about what actually is a business and what are the steps taking to start a business. As I said at the beginning of our past two lectures, where we've been exploring what is an entrepreneur and what it does it take to become an entrepreneur, we also discussed um, what are some common mistakes. And today we're going to talk about what does it take to start a pharmacy business. So this is going to be an overview. During this lecture, we're also going to be talking about challenges and ideas of what might be a unique business. And your charge for this week for an assignment is start to thinking about your niche, your business ideas. Next week, we're going to go into a little bit more detail and lecture of how to discover your niche. But this week, I want you to start thinking about what are some business ideas that you may have. The second lecture is going to kind of give an overview of operational management of pharmacy. And so I also mentioned last week that I will be reaching out to you as I did read your reflective exercises of setting a time and date for us to have our first Zoom meeting. I apologize for not contacting you yet, but you'll either be hearing from me late Friday afternoon or between Saturday and early Sunday. So let us begin. Topics of discussion that I want to talk about today is the business models in pharmacy. I will, throughout this semester, use community pharmacy as a baseline to teach a lot of the business principles, but over the years, I've had many students with great ideas that are related to pharmacy, but it doesn't have to be a store. We're going to touch base on some ideas of what are some opportunities that exist. As I said, the second lecture you'll watch in a video is looking at operation and organizational behavior in business. If you've taken my Pharmacy Practice 6 course, you've heard me talk about the business plan. One of the things, a part of this second part of this concentration is you'll have the opportunity to write a business plan and be critiqued on it and judged on it. You'll also have the opportunity to participate your business idea into several options for competition to test your business idea. And a business plan is an important thing because this is kind of how we can get funded by banks, by lenders, by investors. And this is how we develop the success of our idea, which between today and next week, I want you to start to begin to explore. As I said, a pharmacy business is what you want. What is your passion? An entrepreneur doesn't think about this is a job. This is my life. This is part of my life. This is what I enjoy doing. Creating new things, solving problems for people. This could happen in a community setting, an institutional setting, such as long-term care pharmacy, specialized pharmacy. This could happen in some type of consulting business in pharmacy, or maybe developing some new technology or new operations to help improve the current state of pharmacy. We're going to look at what are the different types of pharmacy business models that exist today from a business standpoint. And then the other thing we always need to be exploring, and this is one thing as you are developing your business ideas, we have to think about how will this business make money to be able to survive. There's numerous examples of pharmacy entrepreneurs. There are private MTM businesses. There is actually a company that's out there that is an online forum for pharmacists to meet other pharmacists. It's called Doximity. There's a nonprofit organization that provides MTM vaccine service for homebound seniors. There is companies that help pharmacists learn to become board certified. Some pharmacists have businesses where they are national writers for publications, or they develop some online audio medication information. There are numerous ideas and numerous areas for this to help improvement of medicine delivery, improving adherence, providing services in underserved areas such as rural health, the development of ways to streamline the process for patients to get access to knowledge about medications or to obtain medications themselves. We also have challenges in becoming an entrepreneur in pharmacy. Be, be, what differs us from other businesses is that we have healthcare policies and we have big companies wanting to have a piece of the pie of the pharmacy business. Whether it's Amazon's acquirement of PillPack, which was an entrepreneur startup company, or the convergence of PBMs, health plans, either buying one or the other, changes in healthcare laws. There are always going to be challenges in pharmacy. But with every challenge, there is an opportunity. How can we improve the ability for people to be able to afford medications? Is there a business to help in the solving of the opioid crisis? Numerous pharmacies have specialized in adherence services. There are ways that we can now partner with different types of care networks, in some states provider status, to get compensation for advanced services. There are companies that help analyze pharmacies of how they may be losing money in reimbursement for filling prescriptions or penalties they may have with DIR fees and contracts. There are challenges in facing pharmacy that sometimes pharmacies are not in network or they don't have adequate staff for training and government regulations. But of all these challenges, there might be somebody having a business to solve these problems, or it's a niche of an overall business that they have. So think to yourself, what are some opportunities could exist for the future of community pharmacy? Last week I gave you some different readings, and if you hadn't had a chance to look at those, please go back and read them. What are the challenges facing hospital, community pharmacy, and healthcare in general? What are the barriers to the future of pharmacy in the community as a business? Some of those barriers we'll discuss, such as reimbursements, in network, but with every challenge, there are also people looking for other ways. There's actually a new pharmacy here in Pittsburgh called Blueberry Pharmacy, started by former University of Pittsburgh graduate Kyle McCormick. If you haven't had a chance, just Google his name, Kyle McCormick Blueberry Pharmacy, located in the North Hills part of Pittsburgh. And Kyle has recently started a new pharmacy that doesn't take insurances. It's strictly a cash-based, but he has some type of service model that you can belong to so that you can able to afford your medications. What are some initiatives that can come about in developing and revolutionizing the pharmacy business? This is what entrepreneurs do. They take problems and they solve them. So how would you approach the trends shaping the future of pharmacy? In the current place that you work or internship, where do you see the challenges? As you interact with patients who may be family members or friends, what are the challenges that they share with what they deal with? What are challenges businesses might have in being able to take care of patients or to be able to stay in business? So what are those challenges that you may think as an opportunity of a new business or service of a business? Additional trends that are influencing pharmacy every day is the rising cost of healthcare. So how can your pharmacy business idea maybe contribute to the solving of the problem of certain costs of healthcare, especially those related to pharmacy? How do we deal with safety in pharmacies that, because of such low reimbursement, have to have a high script volume? We have a high elderly population. What are services are those patients looking for? Not just adherence packaging, but maybe some type of medication therapy management review service to help minimize the number of medications they have to be on, prevent bad things from happening to them, or also that they can be able to afford medications. How do we meet the needs that of our government partners? How do we focus on drug safety? How do we help patients who are seeking self-care, such as over the last couple of years, the CBD revolution? There's always going to be challenges, but with every challenge, there is an opportunity. You might have heard me say this in prior courses, but what customers want is expertise. They want their problem solved and they want to feel good. One of the things I always recommend in starting a business is that you want to start low and go slow, but you don't want to go too slow that your pharmacy doesn't grow. And what I mean by that is businesses have different business type of cycles. If you study businesses that have struggled, such as the big box stores, Circuit City and Best Buy, out of those two, only one has survived, and one has barely survived. The one thing that COVID has done for maybe perhaps Best Buy was people may have been unsettled in getting everything via mail. And then also, because of that, they've had to change their business model, their inventory. For you, maybe old enough to remember how popular BlackBerry was before the iPhone. This was going to revolutionize businesses being able to communicate through email and text messaging. But then Apple came along and created a more easier device. It wasn't that BlackBerry wasn't still popular when the iPhone came around, but the company didn't evolve and wanted to embrace change. If you study the tech companies that I have all listed here, from Apple to Microsoft, and you look at their origins to what they currently are now, they have evolved. All businesses have to evolve to survive, but at first you have to think about, well, what is that business that customers want? Sometimes the customers might not realize what they want. One of the challenges we have in community pharmacy today is we have a lot of patients who just look at pharmacy as just like picking up milk at a grocery store and don't understand the expertise we as pharmacists can bring to them in medication knowledge, disease state knowledge in relationship to their meds. And there are opportunities of how we could possibly get paid. But when you take your idea, you also have to develop a legal structure for your business. One of the things you'll hear me repeat numerous times is that the most important people you want to hire when developing your business is the following: a good lawyer to help you with the legal structure of your business, and also a good CPA, certified public accountant, who knows the tax laws, knows the structures of what's appropriate in setting up your business so that you can also create a way to help protect you and get you financially sound in the future. So, when developing a business, there's lots of things we have to consider. What licenses are we going to need? What are the steps in getting certified or approved by the Board of Pharmacy? What type of liability insurance do we have to carry? What are the challenges of dealing with HIPAA and business agreements? So, the biggest thing when we're setting up our business is we have to do a lot of homework and research. And that is what the second course of this concentration will do next semester. The entire semester is basically focused on your business idea. You'll be exploring everything from what is your business name? And so, one of the things you first want to do is make sure that your business name is unique and you want to insure it. The other thing is you need to research, and depending upon the location of your business in the state or the country that you're in, what are the appropriate licenses for business, federal, state, and local. Over the years, I've learned different laws through students in different states they wanted to settle their business, And also, I've had some students who wanted to settle their business internationally. You may need seller permits. You may have to have certain types of insurances depending upon what is your niche. You also have to think about your business structure from a legality standpoint and from a tax standpoint, because no matter what, we have to pay things such as self employment tax, um, unemployment insurance. So let's begin. What is in a name? Think about what is the name of your business you want to be, because a name creates the image of your company. Make sure the name fits your business. Make sure the company name is easy to pronounce, spell, and remember. Make sure the name allows for the growth of your business. All right. If you had a company that was Bob's Screwdrivers, well, that kind of limits what you can sell. One of the companies that exist now, Dunkin' Donuts. Dunkin' Donuts has slowly been trying to change the name just to Dunkin'. I don't think it's taken off well, but the reason why they want that is they want to be considered more than just a donut shop, that you can get sandwiches, coffee. Also, you want to research the names to make sure they're available, because you don't want to get sued for an already trademarked business name. Is your business local? Is your own name part of your business? Do you want a logo to be an integral part of your business and its name? If you're going to have a website, which I recommend pretty much all businesses, you want to think about your domain name. You can actually reserve your domain name now, and it's fairly cheap. There are several different companies out there, such as GoDaddy, Hover, that will allow you to see, does your domain name exist? And I've actually done this. I've had a couple different domain names of different ideas of businesses I've had in the past. I may not have used them, but what I do is for about $10 a year, I can reserve that domain name. And we'll talk about in marketing the ability to have a website where the domain name is fairly easy to type or is easy on a Google or any type of browser search. Insure your business name and domain. If it's a corporation, it'll be insured when you incorporate. One of the things, once you pick a name, you'll file it with your local county clerk. And before you begin your business, they'll have you publish it, your fictitious name, in their registry. In, I guess, Yellow Pages don't really exist that much anymore, but also definitely at least on the virtual websites where businesses exist. To operate within the law, you have to apply for a business license or permit in the city or county that you're going to reside. It's proof to the IRS that you are in business. If you're going to sell various different items, you may require a seller's permit. And this is required if you purchase items for resale or provide a taxable service. The Board of Pharmacy currently, at least in the state of Pennsylvania, you need to look at, depending upon what state you want to reside, what does the Board of Pharmacy look at in terms of non-dispensing type of businesses. Currently, here in the state of Pennsylvania, the Board of Pharmacy does not look at, if you're not dispensing, you're not really practicing pharmacy. So you may not need a pharmacy license unless you're providing prescriptions. However, depending upon opportunities you may have to bill for your services, you may need certain certifications. And currently, right now in the state of Pennsylvania, because we are not providers, usually you have to use a pharmacy as your billing entity. You also may need, if you're going to do some type of clinical service, a collaborative practice agreement, additional licensing, especially like if you're going to do immunizations. If you are going to be dispensing and dispensing of controlled items, you'll need to also file not just for a pharmacy license for the Board of Pharmacy, but file for a DEA license. Depending upon the nature and the complexity of your pharmacy business, you may need a variety of insurance policies to protect you, your assets, and your customers. You'll need insurances from general liability to professional liability to fire to workman's comp, product liability, health, business property, and disability. One of the things that I do recommend is that the small business borough associations, the lawyer that you would hire to help start up your business will give you recommendations of what type of insurances you'll need. And then what I recommend is you go to an insurance broker that you have no intention of hiring them for purchasing of those insurances, but ask them to do a fair assessment of your business and what liability that you would need. Because they're not in competition and you're just paying them for that service, you're going to get more of an honest answer, and then you can bid that out either locally or nationally, depending upon your situation of the purchasing of these different liability insurances and making sure you're getting a good price, and also the premiums that you would pay if you had to file a claim. When you're deciding on the business structure, there's three types of basic structures. There's sole proprietor, there's partnership, and there's corporation. All of these different structures, you're going to consult your lawyer, but you're also going to consult your CPA. And the main reason why is this is all dependent upon the ease and startup of your business, and also to protect you from personal liability and also for taxes. A sole proprietorship is probably the easiest type of business structure and the least expensive, but you're the sole owner of the profits and losses. So you have total control and less reporting. And basically, you are taxed as an individual. A sole proprietorship may be beneficial if you are just having a consulting business on the side and just slowly starting up. Therefore, you'll be able to, maybe benefit from some tax deductions of your business, but a sole proprietorship is a very easy to start. The disadvantages of a sole proprietorship is there is unlimited liability, so you'll be responsible for all the debt, and this can have a reflection on your own personal credit. Because you're a sole proprietorship, you may be less available for capital loans based on individual financial strength. One of the things that I do recommend for all students who have an interest in wanting to start your own business or be an entrepreneur is start thinking now. Yes, I will have student loans, and yes, I'll have debts in those, but be smart when you graduate. Don't go for that expensive car right away. Make sure your credit rating is good. You'll want to go out and get a credit card so you can develop some credit, but whatever you use your credit card for, or whether you're purchasing a vehicle or any type of large asset, please make sure you have enough money set aside, or a good chunk of money set aside, that you can pay it off. When you pay off those short-term loans, that helps build your credit rating. Disadvantages of sole proprietorship is also limited growth potential due to maybe lack of being able to get funding. And then the other thing too is the business dies if you die or become ill or injured. Partnerships. Partnerships are obviously two or more people who agree to share ownership. The advantages: we have access to more available resources, such as investments from both of partners, talents, and skills. Important partnership agreements, though, need to be developed. And the other thing it's often said about a partnership, it is like a marriage. And unfortunately, sometimes, as like marriage, some bad marriages can end, so can some bad partnerships. And so the disadvantage of a partnership is there's still unlimited liability, and that is why you need a good partnership agreement in case one of the partners decides to back out or doesn't meet their end of the bargain. Profits must be included on each partner's individual tax return according to their percent interest of the company. Ownership. Responsible for each bad debt. So if somebody walks away or skips town, the other one's going to be responsible. Relative difficulty in obtaining large sums of capital, especially if both partners don't have a large collateral themselves, a good credit rating, something that they've acquired assets such as houses, property. It's difficult in disposing of a partnership's interest. And so if you're going to go into a partnership, there should be a way of a partner can get out and how they can be bought out. And also the disadvantage is, are we having a fair distribution of responsibility? A limited liability corporation partnership might be a better idea. Partners' risk is only their investment. They do not participate in the management or control of the business. Advantages: general partners have additional capital to invest. Limited partners have limited liability equal to their investment. And the allocations of income and losses may provide tax benefits in this type of model. The disadvantages is limited partners have no control over the management of the business. Partnership profits are taxed as income to the partners. And especially when you're first starting out a business, you want to at least make sure even though the business may show that it's making money now, there may not be enough cash flow to pull out that you're actually getting that money. You're putting it back into the company, but you want to make sure that if you are in some type of LLC partnership, that you are allotting what each partner is going to have to pay in taxes, and hopefully the business is successful enough, the business itself in its profits can cover your tax of income, especially in those early years. Corporation business structure is the most expensive and regulated structure. It is also very difficult in today's world to sell a corporation to just one person entity. The one advantage of it is that a corporation is a distinct legal entity separate from individuals who own it. The corporation owns its own assets and assumes separate from owners. The downside is you could be taxed twice. So you'll pay income on corporate net income profit and also on your individual salary and dividends. The advantages, though, of a corporation is ownership is easily transferable, and that is great if you have multiple partners wanting to buy in. But corporations of one sole entity can be difficult because somebody may not want to acquire a business due to all the tax and legalities of acquiring a corporation. There is also opportunities, though, corporations for growth and fundraising. Shareholders are only responsible for the amount they invested, and an authority can be delegated to like a board to oversee the corporation. The disadvantages is there's extensive government regulations. There has to be stockholders meetings, high cost and form of maintaining a corporation, and that double tax as I mentioned on the previous slide. One of the most popular types of corporations, though, for small businesses is what's called an S corporation. An S corporation was created several years ago to allow small businesses to have its income taxed to shareholders as if the corporation were a partnership. Now, there's specific conditions for an S corporation to exist. There has to be limited shareholders, so it can't be numerous and unlimited like a stock trading corporation you see on Wall Street, because only one class of stock is allowed. A specific portion of the corporation's receipts must be derived from active business rather than passive investments. And so the business itself has to eventually become profitable. Another one that several business owners may go into is a limited liability company. This is a legal structure that allows the owners to protect from personal liability that is provided to the corporate structure and pass through taxation of the partnership. The advantages of an LLC partners have complete management and control of the business. If greater than 15 to 20 partners, it's probably better to form a corporation. So an S corporation or a limited liability corporation are really for a small set of partners, such as maybe 2 to 3 or 2 to 5. LLCs work well with professional service businesses. They work well for startup companies. They can do that because besides, when you're making money, if you are losing money, but as long as you have enough line of credit to cover during those early losses, there can be some tax advantages to that. Another disadvantage, though, of an LLC is that you have to hire a manager to oversee it, and then most states require that you have filed an articles of organization of how your limited liability corporation is going to run and exist. In one of my prior business lives, I was part of an LLC of a group of independent pharmacies and a long-term care pharmacy. We actually, in the remaining years I was with that business, we switched over to an S corporation for the advantages I discussed earlier. Another option is you could be an independent contractor. So your consultant often choose this structure, but like vendors, except they perform intangible services. Employees, an employee, or an independent contractor. So how does this work? You are independent of the company if you're working for, but there has to be specifications of this. It specifies only the desired results of the project, and the company does not have the right to direct the person with respect to when, where, and how the project is to be performed. Having a contract is important to specify the independence in the eyes of the IRS, because if you can't show that, then you're more considered a sole proprietorship. So, overall advice is, as I said before, some of the most important people you're going to hire are accountants or lawyers. Hire professionals to analyze what you're going to need in terms of liability, and research and research. The other thing is to save money down the road. Maybe you are going to be able to acquire funding so you don't have to use your own money, but that money might come in handy, especially during those lean years when your company isn't making money and you're not drawing a full salary. As I said in one of the earlier talks, entrepreneurs are willing to sacrifice during those lean years to be able to create the great gains in future years. The other thing too in an organizational structure is when you're writing up a business plan and you're also developing your business, structure setup, you're going to want to have names and positions of who's owners, you know, who's in charge, secretaries, treasurers, and duties and responsibilities. So that is just a brief overview of what has to first start before you start a business. What I want to leave you with in the following slides, and then I want you to watch the organizational video, is an example of entrepreneurs in pharmacy. So in 2011, the American Society of Consulting Pharmacy Foundation, and the American Society of Consulting Pharmacy is one of the pharmacy organizations that helps represent geriatric pharmacy and long-term care. They awarded grants to three entrepreneurs who were seeking to establish a fee-for-service component of their senior care pharmacy practice in the community. And there was a pharmacist named Mickey Finnan, and Mickey Finnan was 47 years old and the founder of Medication Advisors PLCC. And what Medication Advisors PLCC is a business that centers on forming relationships with three distinct geriatric markets. This company focused on retirement and independent living communities, geriatric care managers, and private pay patients. So they started by going to these communities and giving presentations on medication diseases to develop their relationship. So this was kind of their marketing tool. So they weren't necessarily making money, but they were using their grant money they had gotten to help start developing the baseline of their business. They developed a marketing philosophy for their medication advisors business. And their philosophy was this: medications can lead to hospitalizations and increased needs for level care. So, a good way to have an elderly person to remain independent living in the community was to use their service. Their business plan also concentrated on geriatric case managers who are actually health and human service specialists who help family members who might need to be, eventually referred to a personal care home, long-term care home. But what their role was to help in improving their functionality so that even if they had to go to a home, they might go to a more like a personal care home versus a skilled nurse home. And what their service did was it did med reviews, MTM type of services, provided recommendations to physicians to help that. So the development of this company was to have an MTM review for all new patients as a selling service and a way of keeping their patients healthier and cost savings. So they developed a marketing philosophy, they developed a website, ways to contact, and what they did was they realized the average patient might not realize the importance of this, but people else they may consult, like geriatric care managers, would realize the importance of this. Another company that over about a year ago, which was recently bought, was CreativePharmacist.com. CreativePharmacist.com was developed by a pharmacist named David Pope. And David was working for a community pharmacy, and they had just become certified in doing diabetes education. But David realized there was many pharmacies that wanted to start doing clinical services, but they didn't understand how are there ways that pharmacy could bill for these services? How can they set up skills to be able to document these services? And how can they solve these problems? So initially, David's company was just a consulting company to help people start up. But then David started focusing on one of the core values, and that was he was trying to teach people how to document for the clinical service, but realized there wasn't a great documentation tool. So David developed, and that's David there on the right in the checkered shirt. David developed a platform to be able to start documenting what pharmacists do from a clinical aspect. And he had the following core values. He focused on servant leadership for both members and staff. So the ultimate goal, they were going to solve problems for the customers who wanted to hire them. He also wanted to be creative of how can we change the way pharmacy acts. So there was a commitment to integrity, an extreme passion, and an empowerment of members and staff. And David actually created a platform called Strand. And that Strand platform actually started becoming one of the documentation platforms for these pharmacy care networks. And just in the last, over about in the last year, David's company grew, but David reached a point where it needed help, so he sold it to a larger company called Omnisys. And David stayed on as a creative person. So some entrepreneur businesses may last you your entire life. Some might be something new that you create that you then sell and you reap the reward of your hard work. So there's numerous ways that we can do lots of things. So I will be posting your assignment for you to send in to me for reflection. But I want you to start thinking the following. I want you to identify a niche pharmacy market idea. How do you think this idea could revolutionize current pharmacy practice? This idea that you're creating, who's your market that would use this new business or niche business? Who's your customer? And do you need to create your market? Who would you market this to? This can be a 1 to 2 page paper, but I want you to start exploring what are some ideas that you think are out there to help solve people's problems. Thank you for listening, and as always, there is a reflection this week. I'm going to be, as I said, either late Friday, Saturday, emailing you with potential times for us to meet. I was also waiting till I got my schedule for the next week, 5 weeks. So I will work with you. I am open to doing early mornings, sometimes during the day, and also even evenings. And these are all going to be done via Zoom. There is one more video after this week, and the reflective paper. So this is a little bit of an easier week because I know you're getting in your other classes. So this week should take a little bit under 3 hours. Thank you very much.